Hey there, I'm Dr. Rafath Baig from Desert Spine and Scoliosis Center. I am an orthopedic spine surgeon, been in practice for almost 15 years, and today we're going to talk about the different anatomic areas of the spine. I have this spinal model here that depicts the human spine, and we'll go through this a little bit in detail so that you can understand what some of the anatomic notations that you may read about on your MRIs or some of the nomenclatures that we'll be discussing when you are sitting in my office. Here is a model of the occiput, which is the back of the head. The cervical spine, C1, all the way down to C7. In between those areas are the discs. So a herniated disc would be at C5, C6. That's the discs themselves don't have their own numeration. So C1, 2, 3, 4, 5, 6, 7. Then you move on to the thoracic spine, similarly T1 to T12, and then the lumbar spine, L1 to L5. And then of course, the sacrum is the base of the spine, S1 to S5, but again, majority of the time, if almost all of the time, we're not dealing with anything beyond the S1 level. That is the base of the spine. The regions that you see most affected, you start off with the lumbar spine and the cervical spine, right? In those two areas, that's where 90% of my patients, if not 90% of most spine practitioners' patients, will be in these areas, lumbar and cervical. Less common will be in the thoracic spine. Again, things such as herniations aren't very common in this area for anatomical reasons. And of course, least common would be the sacrum. The sacrum, almost 100% of the time, is usually related to some kind of fractures, if not some level of insufficiency fractures related to osteopenia or osteoporosis. Every so often you will see a tumor in this area, something that I don't necessarily specialize in, but again, those are extremely rare cases. For the majority of us, we're usually going to be focused primarily in the cervical and in the lumbar spine. The reason why this is important, in our office, we will go through every vertebrae, disc, vertebrae in exhaustive detail with the patient. It's important for the patient to understand what we're looking at rather than simply telling them, hey, you need surgery, which is daunting, especially if there's no explanation to it, right? I always believe that the most informed patient will always make the best decision as to what the course of action will be next. Obviously, it's their body, so helping them understand and making them, momentary mini spine experts of their spine helps them make the best informed decision. And the most informed patient will always make the best decisions for their care. So if you're having neck, upper back, low back pain, or nerve pain, such as sciatic pain, pain that goes from your back into your buttock area and down the leg, or pain that starts in your neck that goes into your shoulder and down your arm, weakness in your lower extremities, or you find that your spinal pain is getting in the way of simple activities, definitely give us a call so we can sit down and review your MRI. Models like this, MRIs, X-rays, and other teaching modalities will be utilized, including even online resources that we'll point you to help you understand what is going on with your spine. Majority of the time, a lot of things you can do on your own will help with this, but the small subgroup of people that will require surgery, that is the group that will become small experts in what is going on with their spine, including numeration, including is it a herniated disc or is it a disc bulge? Is it stenosis or is it, something else? Is it a tumor? Is it a cyst in your back? All that will be exhaustively discussed with you so that you can make the best informed decision. And when we have to go down the path of surgery, the most informed person will always make the best decision and get back to their way of life.